Hello everyone, and welcome to Chapter 13. This is the fourth section. We're going to get started today with respiratory distress and failure. As always, this is Keith Widmeyer with Wayne County EMS. In respiratory failure, there is an inadequate blood oxygenation and/or ventilation to meet the demands of body tissues. A patient in respiratory failure looks very sick and is often very tired. Signs of greatly increased work of breathing are usually present, such as nasal flaring, pursed lips, use of accessory muscles. Patient's skin may appear pale, mottled, or blue, such as, again, what's blue? What's that term? Cyanotic. If respiratory failure is not corrected, it will usually progress to respiratory arrest. Respiratory arrest is the absence of breathing. If not corrected, respiratory arrest will in turn rapidly lead to cardiac arrest. Agonal breathing is slow and shallow breathing that is sometimes seen just before onset of respiratory arrest. Other signs and symptoms of respiratory arrest include the following: unresponsiveness, no air movement from the mouth or nose, no chest rise or fall, change in skin color caused by lack of oxygen. Again, that skin color change will most likely be cyanosis. Alright, let's get started into the assessment of oxygenation. Signs of adequate oxygenation include there appears to be no distress, patient's mental status is normal, and their skin color is normal. When we're looking at skin color, temperature, and condition, what we want to see is the patient should be skin color should be pink, temperature should be warm, and condition should be dry. Signs of inadequate oxygenation include oxygen concentration in surrounding air is abnormal, such as an enclosed space, poisonous gas, or high altitude. Also, we'll take a look at the patient's mucosal membranes and their skin and see if the color is abnormal. If the skin looks flushed, pale, gray, or blue, those are all bad signs. As we talked in previous sections, pulse oximetry is a method of measuring the amount of oxygen saturated in the blood. Pulse oximetry is commonly referred to as pulse ox. An oximeter is a small machine used to obtain this measurement. A small sensor is placed in an area of the patient's body in which pulsation can be detected, such as a fingertip, earlobe, forehead. The sensor is ortho. The sensor is connected to the oximeter, which is a small computer. The sensor passes red infrared light waves through the tissue to which it is attached. Most of the body's oxygen is attached to hemoglobin molecules in the arterial blood. Hemoglobin absorbs red and infrared light waves differently when it is bound with oxygen than when it is not. The oximeter calculates the amount of hemoglobin saturated with oxygen. This calculation is called the saturation of peripheral oxygen, or SpO2. The oximeter displays this value as a percentage on its screen, as well as in the patient's pulse rate. To use a pulse oximeter, start by making sure there is no dirt or obstruction on the oximeter's red light. If dirt is present, remove it and clean the device before putting it on the patient. Usually an alcohol prep will work just fine. Clean the tissue on the patient to which the pulse oximeter will be attached, such as a fingertip or earlobe. If the patient's fingertip is used, remove any dark or metallic nail polish if present. Attach the pulse oximeter to the patient. If the fingertip is used, insert the patient's finger into the oximeter. Make sure the patient's tissue is centered over the light end detector. Turn the pulse oximeter on. To make sure the pulse oximeter's measurements are accurate, check the patient's pulse manually to be sure the pulse rate shown corresponds to the oximeter. The pulse rate in the oximeter corresponds to what you mechanically feel by palpating. Pulse oximetry is routine vital signs that should be obtained on every patient. It's used to detect and provide warnings about low levels of oxygen in the blood. A reading between 95 and 100% generally indicates adequate oxygenation. A reading between 91 and 94% suggests a mild lack of oxygen in the tissues. This can be mild hypoxia. Reading between 86 and 90% suggests moderate hypoxia, and a reading below 85% generally indicates severe hypoxia. Pulse oximetry is as I said, examples of specific situations in which pulse oximetry should be used include all the following: altered mental status, respiratory rate outside of normal range for the age, increased work of breathing, respiratory or cardiac chief complaints, history of respiratory difficulty or respiratory disease, during delivery of supplemental oxygen, during or after endotracheal intubation, and during transport of sick and injured children. Examples and conditions that may cause inaccurate pulse oximetry readings include cardiac arrest, shock, hypothermia, carbon monoxide poisoning, sickle cell disease, patient's movement or shivering, and patients that use nail polish. Cardiac arrest, shock, and hypothermia. The reason is that all the blood ends up getting shunted from the peripheries, the hands, fingers, etc., to the core body, to the thorax, the abdomen, where all the organs are. The reason for carbon monoxide poisoning causing false reflexes is because with carbon monoxide, it binds to hemoglobin similar to oxygen. Sickle cell actually causes a variation in the shape of hemoglobins. If patients moving or shivering, then the pulse ox may bounce around and may get an inaccurate reading. And as far as nail polish goes, the nail polish may block the sensor altogether. And that concludes the fourth section under Chapter 13's respirations.